a guide to fitness, health, and wealth, brought to you by Mass Mutual Miami, where your financial health is our #1 priority. I am Karen Garcia, your host, here with my amazing co-host, Dr. Scott Kjelson.
Yes, hello, hello.
And again this week we are missing our third co-host, celebrity fitness enthusiast, Tony Thomas. He will hopefully be joining us pretty soon, right?
Yeah,
I miss him.
Well, I mean, he does have a lot of priorities, and even though this is one of them, he set a priority with Carlos Boozer's basketball camp today.
Oh, that's right, that's right.
So he left us in the no, I'm just kidding. He's actually doing some great things, and it's going forward pretty well. So
great, so maybe he can bring some tips back from that camp.
Well, we're looking forward to it.
So our goal, as you guys know and you always hear me say every week, is to educate, enlighten, and hopefully entertain everyone on the fact that improving fitness, health, and wealth can always lead to overall success.
Yes, and today's theme is thinking ahead. And we always have conversations about this. You know, there's so many different age groups, and ideally when you're younger, you don't really think about long term. You don't think about how you're going to feel when you're older. You think, I'm healthy now, I eat this now, I work out now, I look good. What's on the outside is not what's on the inside. And you always hear the concept, you can't teach an old dog new tricks as well. Well, I say that's absolutely wrong. For instance, my grandmother's 80 plus years old, on Facebook, she's playing Words with Friends. She's keeping her mind going. She does work out. She has a bike in the house. You know, and the concept is she took the time, and also we, as her grandsons, took the time to teach her.
Educate her and help her.
Right, so it's our job to incorporate ourselves into their lives and be that person, because we do have a lot of education. We do see the direct-to-consumer advertisement. We're out there. We see the marketing, because the marketing's to us. We're the people spending the money.
That's right.
And ideally, yeah, I think it's so important for our age group, a younger age group. We're taking care of our parents, our grandparents, to incorporate ourselves, our knowledge. You know, one of the things that we do talk about is long-term planning. And I'll say this. You can plan, you can plan, you can plan. You may never use it, but 90% of the time, you need it.
Right, and when you say plan, clarify that. You mean planning for the future, right?
I do.
You're talking about, so there's different kinds of planning. We always talk, I know I always harp on, retirement and enjoying, but today I think we're thinking a little further than that. We're thinking about long-term care planning.
Correct.
Like your grandmother, for example,
Correct.
like my parents and my grandparents, which are no longer here, but they needed it, which is what happens if and when, God willing, we get to a certain age where, we're living our retirement, we have X amount of money saved up, and now all of a sudden we need some help in the home.
Well, we're using that money for our health care.
Exactly.
Right?
And so now what happens to that quality of life? It's depleted because now we're spending that money on maybe nursing homes, maybe home health, etc. So that's what we're addressing.
Well, yeah, and a lot of people think I could be the richest person in the world. We spoke about this before. You can be the richest person in the world, but if you're sick, you spend your money on health care.
Exactly.
Now, you know, we have a special guest today with Dr. Robert Littman. We'll bring him on in a little bit, but I can tell you, just from my grandmother, we spoke about this previously as well, but just from my grandmother's standpoint, it was so impactful for me to understand just simple myths, understand little concepts to help her out. I mean, when my grandmother, I looked into her healthcare, I didn't realize, why she was having pains. I didn't realize why she was, groggy, and I felt like, you know what, and many people feel the same way. They're just getting older. These are the normal things.
Right.
Aging.
We just attribute it to, I'm getting older.
Right. But when you actually look what medications they're on, what their diet is, how they exercise, if they exercise,
right,
how important that concept is, you look at all that and you're like, wow, this person could be healthier, and it's not too late.
See, your grandmother, I consider, was very blessed to have you and your brother in her life, but a lot of people don't have the knowledge you have.
Correct.
So what we need to do is educate ourselves as much as we can, not just for ourselves, but for our parents and our grandparents that we love,
right,
to be able to give them those tips and tricks, little things to keep them active and enjoying.
No, it's one of the most important things. I was very fortunate to, again, have people in my life to educate me, and again, I mean, I'm able to see my grandmother smile. She's doing so much better now that she's eating healthy.
Nice.
She's working out. I mean, her attitude is motivating, and not that it wasn't before, but it's just, it's so great to be able to see the results of positive movements in somebody's life. So,
well, I love to hear you speak this way, because generationally speaking, a lot of times this topic is just not sexy.
It's not.
It's not sexy. It's not anything. I mean, I'm almost fearful that somebody's going to be listening to us saying, today we're talking about long-term care, and be like, turn the dial.
Let's, hey
You
guys,
know?
we're gonna get together Friday night and talk about our grandmothers.
Exactly. It's just not sexy.
Right.
But guess what, people? We need to, in order to enjoy those Friday nights and Saturday nights and really do it in a way that is stress-free, we need to plan. A little planning goes a long way. And so the thing I want to address, so we talk about fitness, health, and wealth, right? And Dr. Robert Littman is going to address a lot of that. I want to address the financial part of this. And what this means is, yeah, we always talk about save now and travel when you're retired. Again, what happens if there is a small long-term care need situation? Maybe somebody has a stroke, and so it's not so small. Maybe you need to go into an assisted living facility. All that money that you thought you had to spend to live it up in retirement could be depleted instantly if you're not careful. One major surgery if you don't have the right insurance in place, could really, wipe you out.
Yeah.
And so it's important to plan for that. I think there's a statistic that a lot of people don't realize, but for example, I brought this here. In Florida, did you know this, Scott? The median cost for a nursing home, private room, which, we want to maintain our dignity, right? We don't want to be, rooming
Thrown in.
at that age, exactly,
yeah.
would
No
be
bunkmates.
median price cost $251 a day. Do the math, folks. Most of us would be wiped out if we had to go into that without any proper planning.
Right.
So what can you do? Well, there are certain insurance products you can purchase. There is standalone long-term care insurance, a fantastic product to consider. However, you have to be careful. You have to be advised by the right advisors, because if you walked into my office today and say, I want to buy long-term care insurance, I wouldn't immediately go and say, here it is, here's the product, and this is what you're going to pay. Why? Because you are many years away statistically. I mean, God forbid, you could go into a long-term care situation next week if you had an accident on a motorcycle
I'm a little
or had a
old
stroke.
man,
But my point is, I wouldn't just go out and immediately sell you just, hey, sign on the dotted line, buy a long-term care policy. Because he might be paying for this for so many years before he actually sees it. And so his age is not the ideal age to buy an outright policy. That's not to say you couldn't buy it, but I would look at other options. And what are those other options? Well, you want to leverage the money maybe that you're saving to grow it, maybe for retirement or for future purchases, and build flexibility around that money to be able to pay for long-term care.
Right.
And how could you do that? Life insurance with cash value built in is an incredible, flexible way to pay for long-term care needs. So it's not earmarked for long-term care, but it is accessible in a tax-free way.
Now,
Go ahead.
I don't want to lose people.
Okay.
Because, again, what I understand from you all the time is that you provide options.
Options,
So
solutions.
it's a savings plan. Who doesn't want to have money, right? So like the concept is, if you never use it, you can use it, right?
Exactly. It's not
you
a
never
use it
for
or
that,
lose it.
You
Right.
use it.
Right.
You don't use it, you use it.
Exactly. So that's a great point that you brought
Right.
up. So long-term care insurance as a standalone product is a use it or lose it product. We sell that, and it is appropriate for many people, usually in their 50s. However, the catch is, by the time you get to 50, you may not qualify for long-term care insurance if you have any particular chronic conditions that the insurance company is going to say, no, he's most likely or she's most likely to use it. So that's a use it or lose it situation. But what you're saying is a use it or use it, it would be the cash value in a life
I just
insurance
think
policy, your savings.
I think people need to take into consideration the idea that you're protected. Why would you not want to protect yourself? Why would
Exactly.
you not want to have that backing? It's like a safety net, right?
Exactly.
So like, I'm putting my money towards savings. I'm taking care of my health care, which is one of the most important things. I mean, we'll get into statistics, but the idea that, for instance, baby boomers is one of the biggest debts in the United States in healthcare sense,
Right.
And there's more and more and more. What do we have to do is take care of that planning.
That's right.
Right.
And planning goes a long way, and it goes back to what I always say, and I feel like it's general, but it's not. If we can all realize that we're planning, we want to maximize our wealth, minimize our taxes, minimize our risk, then that money can be used in so many ways, and one of the ways is long-term care. So with that, I think we can wrap up this section and say that this Thinking Ahead segment was brought to you by Genobic, improving your quality of life through personalized testing.
And now we have a very, 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 very
Very.
special guest on today, Dr. Robert Littman, also known to the
Hello,
masses
welcome.
as Bob. He's a professor at several universities. He studies and also specializes in geriatric medicine, nutrition, and he serves as an expert witness for malpractice and wrongful death cases, and also my personal mentor, and the reason I can say that I'm doing what I'm doing. Thank you for coming.
Thank you for having me. Glad to be here.
It's an honor.
We do appreciate it. Now, just really quickly, I want to introduce you. You're a consultant pharmacist.
Yes.
So many people don't know what that is. Can you tell us what that is?
Consultant pharmacist is a specialty license for pharmacy in which we primarily practice in long-term care setting. It's a clinical pursuit where you're evaluating patients' therapies and charts. And I really believe our goal is to try to reduce medications, unnecessary medication therapy, and to fine-tune patients' drug regimens.
So you actually want to see better health outcome?
Yes, exactly.
Oh, okay.
And my personal focus is to look at underlying nutritional deficiencies before using drugs and resorting to drug therapy.
That is so refreshing because, again, the average person who is not a doctor of pharmacy would think, at least I don't know if I can speak for everyone, but would assume that a doctor of pharmacy would all be, pushing medication. But it turns out that I've met two amazing doctors of pharmacy who are actually trying to look at the underlying reasons behind illness, trying to prevent
Exactly.
the mass use.
And you have to realize that drug therapy is very dangerous, that there's close to 150,000 deaths every year in the United States from properly prescribed medications.
Are you kidding?
Yeah, that's not just wrongful, right? Like,
It's not just
not
a
even
mistake.
including wrong.
No, it's not. This is properly prescribed medications, but there are adverse drug reactions, drug interactions, inappropriate selection of agents, of certain pharmaceutical agents. So I like to try to, as I said, look at underlying causes first before we resort to drug therapy.
So tell me a little bit about the underlying causes. For example, what is it that you're looking for?
Well, for example, in my nursing homes, we try to do vitamin assessments of all our patients. We look at B12, folic acid, vitamin D, magnesium, things like that, which will help treat the underlying causes. B12 and folic acid deficiency has been associated with depression. And as you probably know, that antidepressant drugs are probably the top-selling drugs on the market today.
It almost feels like everyone that I know either is on some sort of antidepressant or knows someone that is.
Well, look in the long-term care facilities. Let's say a lot of people either are in a new atmosphere, lose a spouse, right? Or just being away from their family can cause temporary depression. Am I correct?
Exactly, and that to me is what I call a situational depression.
Okay.
Where the life circumstances, dealt you a serious blow, and you're depressed, and people do need time to come out of this and to adjust to their new surroundings. But immediately we tend to have this gut reaction where we must treat right away, and we want to treat the symptoms immediately, so we put patients on drugs, and many times it's not appropriate.
So, I'm sorry. Is it okay? I'm asking questions.
Yeah, of course. I want to know more.
So again, you mentioned vitamin D. Well, I go to the beach quite a bit, and I get plenty of sun. Isn't that enough?
Actually, it's not. And there's quite a big misnomer about vitamin D. Everybody thinks if you go to the beach, you get plenty of sun, you get plenty of vitamin D. But actually, vitamin D is only synthesized when the sun is at a greater than 50% angle from the horizon.
I have to bring a protractor to the beach.
You really have about a 3-hour window to absorb UVB rays, which convert cholesterol to vitamin D. Anything else prior to that or after that, you're getting massive amounts of UVA, which lead to skin cancer.
So for people, let's say golfing or people going to the beach, what times would that be?
The best times for making vitamin D are probably between 12:30 in the afternoon and about 2:30 in the afternoon.
Which is usually when I avoid it because it's too hot.
It's the hottest time of the day, exactly.
So there you go.
But the sun is at its highest angle, so you're producing more UVB.
Amazing.
Now, people who live above the latitude of, say, North Carolina, and during the months from September through May, virtually get no vitamin D production because of the angle of the sun and that latitude.
Wow.
So all these patients need oral supplementation.
And where would I get? Do I need to go to a doctor to get the oral supplementation, or I just go to the local health food?
I recommend going to your doctor to get tested, to have your vitamin levels tested. And the test they would do would be a vitamin D25 hydroxide. Based on the results of that, you can determine how much vitamin D you would need. But I personally tested myself and found I was deficient.
Wow.
So I'm currently taking 4,000 units of vitamin D every day.
Now, I want to jump into that a little bit because you said you were tested. Can you just talk just for a minimal amount of time, about your experience with, let's say, the naive market of people that don't get tested, and how important it was for you to actually get tested.
Right. I believe knowledge is power. And the only way to find out is through testing. And I'm very impressed with what Scott's doing with genomic testing. This is really tapping into the latest cutting edge technologies to assess the wellness or the status of a patient. Looking at nutritional factors, excuse me, looking at dietary factors. These are the keys to health and wellness. We take care of that, and we'll find we're going to need a lot less pharmaceuticals.
And you were at a point in your life, a lot of people, like we spoke about earlier, they don't realize that they need to prepare. And you thought you were healthy. You were a world champion. I don't want to say it incorrectly if you don't mind, but you were top in the world.
Of what? What's the sport?
Frisbee, right?
Well, we came in second in the world tournament at Ultimate Frisbee.
Ultimate Frisbee. And you thought you were the healthiest you were ever in your life.
Right. And at this point, I was actually one of the oldest players in the sport. Ultimate Frisbee is a very demanding cardiovascular sport, and I've been playing for about 20 years. We did play at the world tournament, and we finished second, unfortunately. But it was a wonderful experience. And I thought I was in the best shape ever. I retired from Ultimate at about the age of 52. And when I retired, within the year, I developed atherosclerotic. Well, I didn't develop then. It's probably a long, insidious process. But I was diagnosed with atherosclerotic heart disease.
Oh my God.
And I required open heart surgery and stents in my kidneys.
So going back, healthcare, how important that was.
Oh my, so imagine, my question is, and this is personal, so you don't have to answer it if you don't want to, but did you have health insurance?
I was lucky. I did. Now, I was pretty much uninsured for the 10 years prior to that time.
Look at that.
But my son was born at that time, and I thought that I should have health insurance because I now had a family that relied on me. And I was very lucky because my expenses were close to $500,000. If I hadn't had health insurance, I would be I would be in bankruptcy right now.
I hear you. And see, this goes right to the core of what we discuss here. Is it's all related. Health, wealth, fitness. It really is all related. I mean, like Scott always says, so what if we're planning and saving and saving and planning if you don't have your health? You could have your health but not be able to enjoy it if you don't have the money. It really, truly is all related.
Yes, and you think about it, people work their whole lives to save up money so they have a nice nest egg, and the majority of them spend it on their health, dealing with health issues.
Well, I want to ask specifically about that because you said you specifically work in a nursing home environment. And that is one of the biggest misnomers I have is some of the clients that walk into my office and say, long-term care, oh, I don't need that. I mean, I know the government takes care of that. Isn't that what Medicaid is for?
Yes, well,
give us a little bit of the truth behind it.
All right. Actually, Medicaid does cover about 70% of nursing home admissions.
Okay.
But to qualify for Medicaid, you have to prove that you have no money, that you are essentially bank broke and have no assets.
Nothing.
And there's actually a 5-year look-back period. So you can't say, well, I need a nursing home now. I'll give all my money to my kids,
right,
and then I'll go to the nursing home. You have to wait 5 years. Many people don't have that time.
And who can time it?
Exactly, you
How
can't.
can you really time it?
And when you have, let's say, for example, atherosclerosis.
Right.
It's a silent disease. You don't know you have it until you end up with a major stroke or a heart attack. And in this case, then it's too late to go ahead and give away your money and look back. You need a nursing home right now. You need care immediately.
I got a question for you. This may throw everybody off a little bit, but if you could change something within your field of expertise right now, what would you change, and what is your focus? Like, what do you see, and what could you fill a gap in?
I feel that I would love to see that there'd be more testing of all our patients and a more in-depth testing that we're doing. We're doing generalized, as I said, B12, folic acid, magnesium, vitamin D, things like that. But I think the testing that you're doing, and if we could apply that to every nursing home patient, we would have much better therapeutic outcomes. If we can know what patients can eat, what they can tolerate and can't tolerate.
Well, I would love to see that, but I would also love to see more communication of people in a group. We go to a hospital, you get a specialist, you get a physician, you get a nurse, you get a physical therapist, you get rehab, you do it all there. But you go out and it's like, have a good time finding out who's going to take care of you.
Right. Well, nursing homes do have what they call a care plan team.
Right.
And they do have an interdisciplinary team that does assess the patient's needs.
Right.
But you have to remember that most nursing homes have an average of 100 patients, some 200
They're
patients.
taxed.
And
Yeah.
we have a limited staff and we have limited facilities to deal with their issues. So although we come up with a good plan of care, it's often difficult to follow that.
Well, I think this is fascinating. We can certainly have Dr. Lippman on.
Yeah, we need you back.
We need you back. Will
I'd
you
be
come
glad
back?
to come back.
Yeah, and we'll have some
Fantastic.
post discussions with you as well. But we do appreciate it, and we're just going to go right into our next section. This segment with Dr. Robert Lippman was brought to you by Workout Your Wealth, promoting healthier and wealthier living through sound financial and wellness services. So now we're going to jump right into a special version of Doctor's Lowdown. Doc, we're gonna have you on because again, you're my mentor. This is you. So if you can, give us a little tip for everybody out there.
If I could give you one tip, a good takeaway is to keep moving, to get up and walk. Many patients don't have accessibility to gyms and to workout equipment, that everybody can get up and move and walk a little bit, get out, get up off your chair, get away from the television, and walk, walk, walk.
Right,
Love
so
it.
even if you have that support system, a walker, a cane, whatever
Anything,
the case may be,
just
Exactly.
move.
If you're in a wheelchair, stroll, stroll, stroll.
Right.
Get out and move.
Look at that.
Moving is important.
So I would say and I'm taking over Tony's tip of the day because he's not here, but we always have to make sure that we take over and try to do something as good as he
Well,
would.
here we go. Here we go.
Yeah, so I would say that his tip today would be to stretch. And we go back into this all the time. We spoke about it before, but just like walking, stretching, how important that is, and increasing the blood flow, increasing the range of movement, and just trying to make yourself healthier every day. So between walking, stretching, and
Here's one that I'm going to just throw here. Here's
yes,
Karen's concept.
Karen's concept.
Nothing to do with walking and stretching, but something to do with Dr. Lippman, what he just said, which is I encourage each and every one of you, if you have or have considered a long-term care insurance policy, there is something called a partnership policy, which says, in a nutshell, that you can actually protect the amount of premiums you put in to purchase your own long-term care from Medicaid so that you can spend down your policy first. And then if you were to need Medicaid to step in, they would protect the amount of money you put in. So you wouldn't have to spend it all down or basically be broke at the end of your life. Does that make sense? So I encourage everyone to look into that because that's something that does exist. Well, thank you again, Dr. Lippman,
a
for
pleasure.
being here with us today.
Yes,
Thank you very
and don't forget to follow us at blueprintradioshow.com where you can find all of our sponsors, our links to social media. And if you have any questions for us or you want to hear more or any subjects, please reach out to us. Thank you to Tamarina, beautiful place that
We're
we're at
back.
today. We're back. Into a media group, Genovic, Workout Your Wealth, attorney Matthew Zukowski, and of course Mass Mutual Miami, and our newest sponsor Echo Media Productions. And Doc, thank you. We
It's my
really do
pleasure.
appreciate it.
Thank you.